Welcome to the legislative update for the week ending Friday, June 11th. My name is Colleen Patterson, and I'm the Director of Employer Services and Compliance at Savoy. Recently, the EEOC released guidance related to workplace vaccinations. I wanted to go over a few key takeaways, including the following. So first, an employer may require all employees to physically entering the workplace to be vaccinated for COVID-19, subject to certain reasonable accommodation requirements. Reasonable accommodations can result in non-vaccinated employees being treated differently than vaccinated employees. Some examples of permissible reasonable alternatives can include requiring unvaccinated employees to 1, wear a face mask, 2, social distance from coworkers and non-employees. Also, employers may actively encourage employees and their family members to get vaccinated. Employee vaccination status is confidential medical information under the ADA. Employees who are fully vaccinated may request accommodations for an underlying disability due to a concern that they face a heightened risk of severe illness from a COVID-19 infection. Lastly, employers may offer incentives to employees who can demonstrate they have been vaccinated. So next, I wanted to mention something that we've talked about previously, which is the new rules that are impacting mental health parity. We're hearing from industry colleagues that there's a significant increase in DOL audits specifically for non-compliance with new regulations surrounding mental health parity. So I wanted to take a couple of minutes and just connect the dots. So first, let's start with the Mental Health Parity Act, which was established in 1996, and it provided that large group health plans cannot impose annual or lifetime dollar limits on mental health benefits that are less favorable than other limits, such as medical and surgical benefits. In 2008, the Mental Health Parity and Addiction Equity Act was signed into law, preserving the Mental Health Parity Act protections. And it significantly added new protections, such as extending the parity requirements to substance use disorders. Fast forward to 2010 with the passing of the Affordable Care Act, and the ACA continued to build upon the Mental Health Parity and Addiction Equity Act and requires coverage of mental health and substance use disorder services as one of the 10 essential health benefits categories in non-grandfathered individual and small group plans. So now here we are in 2021, and the passing of the Consolidated Appropriations Act, as we know, largely addressed issues related to COVID-19 and the pandemic. However, the law also contains many sections covering other health policy issues, and one of those sections is to improve compliance with the non-quantitative treatment limitation requirements that are outlined in the Mental Health Parity and Addiction Act of 2008. So the reason I wanted to go over this timeline and the various laws that have been impacted over the last several years is that, again, we are hearing from several industry colleagues that there's been a significant increase in clients being audited by the Department of Labor for non-compliance with new regulation surrounding these mental health parity rules. It is very important that both brokers and employers familiarize yourselves with these requirements as the DOL enforces these rules. Non-compliance can result in financial penalties where the fines for employers can be as high as $100 per member per day for non-compliance. So it's very significant. So if you haven't seen this information yet, or you haven't had an opportunity to really dive in, definitely check out the articles on our website because it is critically important considering the uptick of audits. So moving along, I wanted to go over some information as well regarding ACA reporting and specifically penalty notices. Earlier in the year, the IRS sent out penalty notices, and what we're hearing is that the next round is going to be released in the coming weeks. And from what we've been hearing as well, it is expected to be a significant amount of penalty letters being released. Enforcement is picking up on these notices, and the tolerance level from the IRS due to incorrect reporting seems to be much less than it has been in years past. It's becoming increasingly difficult to reduce and even get out of these penalty notices altogether. And the reason for that is because the stance from the IRS and that they're taking is that the reporting has been in place for several years now. So there's been a significant amount of time to get it right. As we know, the burden of proof always resides with the employer to show a timely offer of affordable coverage that's met the ACA requirements, and it always falls on the plan sponsor. So lack of documentation or understanding is becoming increasingly difficult to use as a line of defense against those penalty notices. So we are expecting to see enforcement also about the 1094 forms themselves, meaning that if the forms are incorrect, those penalties will apply in addition to the possibility of a plan sponsor facing penalty A or penalty B. And remember, the penalty for the forms is completely separate from non-compliance to the ACA, which would be penalty A or B. Speaking of ACA reporting forms, I'm not sure if I mentioned this a couple of weeks ago, but the 1095 B and C forms, the draft forms that is, they were released by the IRS. But just this past week, they also released draft forms of the 1094 B and C. What we do expect to see in a couple of weeks is certainly the instructions to be coming out as well. So changing gears a little bit, there's actually some news on the state level. So I wanted to go over a couple of updates. First, we're going to start with Connecticut. Recently, a bill passed in Connecticut extending dental and vision coverage to young adults, stepchildren, and other dependent children, permitting them to remain on their parents' dental and vision insurance through age 26. As we all know, the Affordable Care Act allows young adults to remain on their parents' insurance through age 26, but the same has not always been true for dental and vision coverage, and that is now changed in the state of Connecticut. Happening in New York, the Department of Labor announced that employees must be permitted to use sick leave under the New York paid sick leave law to recover from any side effects that are stemming from the COVID-19 vaccinations. So this concludes our update for the week. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use the resources that are available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.